thanks for having me here. I've been involved in patient advocacy since I was a little kid. When I was 10 years old, my mother was working at a nursing home, and the easiest way for her to babysit me after school was to turn me into a candy striper. So I became a volunteer at the nursing home at 10 years old, and I haven't turned back. I'm not still a candy striper, but you know what I mean. I'm still really involved in patient advocacy and working with people of all types, all ages, all disease states. I did about 15 years at Columbia Medical Center as a clinical trial coordinator, and I was working with rare disease patients. When I got out of medical assistant school, this was back in the early 90s, there was still a lot of activity going on in AIDS research, and I became a phlebotomist at one of the busiest AIDS research centers in New York City. So yeah, I like being on the front lines with patients where the problems exist and finding solutions for them and giving people the tools to empower themselves to navigate our not always easy healthcare system. So yeah, I've just been living this my whole life, and I've landed here at Patients Rising, and I'm thrilled to be here because I get so many opportunities to work with all different kinds of people, patients, caregivers, their family members. Yeah, I feel very, very fortunate.
Well, we are fortunate to have you in our ecosystem and sharing as well. And I know we're going to be talking a lot about Patients Rising when we mention that, and we'll be sure to include links in the description of all our videos so people can learn more about the organization. Can we start there too, on sort of maybe a top level, like what is Patients Rising, since we're referencing it so much?
Oh, sure. Yeah. Well, Patients Rising is a 501c3 organization, a nonprofit organization, founded back in 2015 by Terry and Jonathan Wilcox. Terry is still the co-founder and CEO of Patients Rising. And the organization was built to provide both support, learning opportunities, and advocacy opportunities for patients with chronic illness, rare disease, or other kinds of disabilities. To fulfill that mission, we do a lot of projects that try to support patients across different disease states. So, for example, rather than doing a class on multiple sclerosis, we'll do a class on the issues that affect lots of different disease states, maybe including multiple sclerosis. And these are often, as no surprise to the audience, I'm sure, is navigating insurance issues, or communicating with your physician, or at an even higher level, getting involved in legislative advocacy. Because if we can change the rules of the game by interacting with lawmakers, we might have a healthcare system that serves us all a little bit better than this one now. So if you wanted to learn anything about what's going on at Patients Rising, I'll give a shout out to Joe, our chief digital officer, for setting up the patientsrising.org. He's organized the site so that it's pretty easy to find all the different things that we're doing. So if you went to our homepage, patientsrising.org, you'd find a link for getting help, which is where our patient helpline lives. You'll find a tab for learning and resources, and that's where our patient learning center lives. And you'll find links too to get across over to our 501c4 organization, Patients Rising Now, which is where our legislative advocacy takes place. But I think I want to talk first, if you don't mind, about the Legislative Advocacy Masterclass, because it's something all three of us in this room right here have in common.
Yeah.
It's a pretty exciting program that Terry built about 4 years ago now. And it's a course comprised of 12 different lessons. It used to take place over like a 15-week period, but we've consolidated it so that we can get more people in to take it. Essentially, what the Legislative Advocacy Masterclass does is teaches people how Congress and the government works as far as making and changing laws, as well as different mechanisms where patients can get involved in advocacy work. For example, you can get involved in FDA meetings, ICER meetings, drug utilization board review meetings. We want to give people the tools that they need to have their voices heard in the places where the decisions are being made. It's really easy to get stuck in sort of a passive role in healthcare, where you just kind of do as you're told. And I'm sure the healthcare system would really appreciate it if we all just shut up and did what we were told. But that's not our style, is it, folks? So we're all about making sure that the patient voice is loud and clear and can't be ignored. And so the masterclass is designed to help give people the tools to do that. When you graduate from it, you'll have skills like how to write legislative letters, to your congressional representatives. You'll be able to participate in our annual fly-in, which is that's a pretty exciting gig right there. I'm not going to lie. It's where a whole bunch of really motivated advocates get together, go to Washington, D.C., and organize meetings with dozens of congressional offices to promote the bills that, at least at the time, have the potential to make the most difference for patients. Things like the Safe Step Act, the Benefit Act, and other similar bills that will really, we think, change the landscape for patient empowerment. But getting together at the fly-in, that's a hoot. It's a hootenanny, if I can use that word.
It was so much fun. And actually, surprise, surprise, I have a picture of all of us.
Oh, no way.
Yes, let me just show it over our faces. Really, look at this picture, everyone. All of us advocates.
Look at this. This is like looking at a photo of the Justice League. These are like superheroes.
Yes.
Oh my goodness.
It's a powerful picture.
Wow.
Take a look at that. Powerful chronic, advocates, patient advocates, caregivers. Everybody was with us that day. It was amazing to be at Capitol Hill working with everybody.
Oh gosh, yeah, there were people come in from Hawaii, all states across the country. Wow, yeah, it was a heck of a turnout. What a good feeling too. I mean, speaking up for yourself is important. Speaking up for yourself in a group setting where everybody is sharing the same kind of energy. Ooh, boy, that's powerful stuff. When I come home from the fly-in, I'm both completely exhausted, but also supercharged. It takes me through to the next fly-in. I mean, because it's just that much energy involved. So yeah, anybody who has any questions about that ever, reach out to me, or frankly anybody in the organization, because the fly-in and the masterclass are real hallmarks of how we carry out our mission for patients. We also have something. If you're interested in getting involved in advocacy or becoming a stronger, more effective patient, but you don't want to go to DC and get involved in legislative advocacy, we have another program called Be Your Own Best Advocate, which is a series of 10 classes that make up a full course that teach things like communication strategies with your doctor. What are your rights as a disabled person? How can you make changes when you find errors in your medical records? What if you're a person from a marginalized community? How do you speak up for yourself at a hospital or with your healthcare providers? The things that patients came to us and said, these are things I struggle with. So we built a series of lessons to try to strengthen where people felt like they needed some support. And they're all led by brilliant chronic illness patients who have careers in advocacy and teaching and communications and filmmakers. We pulled out all the stops, folks, and it's fun, it's easy, but it's also eye-opening, a little mind-bending. It'll really change your perspective both on yourself and how you can interact with the healthcare system around you.
That's incredible. I think that's so important, and people don't even realize, even when you don't have a chronic illness, how important that is. I find so many friends or family members that will come to me and be like, this happened at my doctor's appointment. I'm like, no, you had a right to, say no, or like have this not happen. So I feel like even sharing that to just anyone's family or friends would be huge. I always want to go to my family or friends, like doctor's appointments, to be their advocate for them. But having them learn to be their own advocate would be like incredible. I think that's a class everyone should take.
I completely agree. And to your point, Danielle, I think I think doctor's visits usually go pretty well as a team sport. When the patient goes in to a doctor's appointment alone, I'm sure there's a lot of people in the audience right now who have experienced this. You go in with some questions, some things you want to accomplish. But guess what? The doctor has some things that they want to talk about and accomplish. And your things and their things are not always the same thing. So you get your 7.5 minutes or whatever you get with your doctor. And when you walk out of the office, you often find that you didn't get any of your questions answered and you feel more confused than when you started. So there are some good strategies and don't worry, this isn't spoiler alert. I'm going to give away all our secrets right here. So having somebody with you to take notes, to remind you about the questions you wanted to ask, and that partner, that buddy, consider it like a buddy system, needs to be the kind of person who doesn't mind interrupting people and being a little on the loud side. The sad truth is when the squeaky wheel does get the grease. So you have to be prepared to speak up for yourself. And if you're kind of timid, you're unsure, bring that friend or family member who's really obnoxious and doesn't mind chiming in on your behalf, because it really is important to make the most. I mean, think about it this way. It takes you probably 6 months to get an appointment with the doctor, the specialist that you need. And you're going to get, if you're lucky, you'll get a half an hour. Most of the time you'll get 15 minutes. And if you don't get what you need out of that visit, you're going to have to wait 6 months again. What? That's insane. So you got to make sure that in that visit, you get what you need, because otherwise you get put to the back of the line again and you got to make your way to the front. And that's no way to live. I learned that lesson the hard way myself. So be bold, be brave. And if you need some tips on how to do that, come take our Be Your Own Best Advocate class. Totally free. It's like I said, easy pickings. We're not going to break your mind bank here. And if you do that and you feel like you want to get even more involved, we've got the Legislative Advocacy Masterclass waiting for you. You can take that again for free and get involved in the fly-in eventually. Yeah, we try to build enough support so that we sort of look at it as a patient comes to us newly diagnosed. They're confused. They have a lot of questions. So we want to teach them, here's how to learn more about your diagnosis. Here's where you can find other people, support organizations like Support Fibro, who can help answer some of your questions for you, because they've done a lot of the hard work. They've had to beat through the bushes to find answers. So instead of you starting from square one, lean on your peers and your companions to share information that they've learned the hard way. And we believe that big network, all working together, that's the key to having success in healthcare.
Absolutely. That's why we collaborate so much and we talk about Patients Rising work so much, because on one front, we do legislative advocacy for fibromyalgia, but we get a lot of questions on other healthcare policies, things at state levels and even federal level. So we refer back to Patients Rising, take the masterclass, learn more of people that have gotten really excited about doing advocacy, or like you mentioned, the other class, being a better advocate in the doctor system. A lot of questions we get of people understanding, people have been amazed after they've learned this too, is the medical notes and understanding that you can also go back to your doctor to change things. But it's hard because there's a lot to do, and patients need to be more supportive in this environment as they go back and forth, because we're hearing from some people in the audience right now that they do feel dismissed, or it's exhausting to try to go through this whole process on your own.
Gosh, it's a truer thing has never been said. It is exhausting. And it feels like the system is built not for patients, but for someone else who knows. But it doesn't feel easy for patients. And it should be, if not easy, certainly easier than it is right now. And I think we can do that when we work as a team. For instance, we've put together something called the Storytellers Guild, because people were having difficulty owning their own narrative. I have a diagnosis, right? But I'm also I'm a husband. I'm an employee. I'm a brother. I'm a son. I have lots of different identities, not just one that comes with a diagnosis. So how do we come to terms and pull all that together so that we maintain our own dignity while also speaking the truth to people who need to hear it. It's not easy. It's a balancing act. So we built the Storytellers Guild to have monthly workshops, writing prompts, just to make you think a little bit more about how you talk about yourself. Maybe not just to your doctor, but to your fellow fibromyalgia patients. How do you talk about your disease to your family? We just got past Thanksgiving, and I can't see you raising your hands, but I bet if I asked you to, there'd be quite a few people here who had awkward conversations about your condition over the Thanksgiving table, because you're trying over and over again to explain why, and an invitation to dinner is a beautiful thing and we don't want it to go away, but you also have to understand that I don't always have the spoons to do it. These are awkward but really important conversations. So how do we tackle those? We just learn better communication strategies. And so we try to help with that too, because we know it's not just about laws and state policies and hospital charters and things like that. It's also how you see yourself, how you interact with your loved ones, how you stand up for yourself in the workplace. All of these things matter, all of it. And my promise to you is that I'm always listening. So if you have questions about these things, problems that you're encountering, bring them to me and I will try to find ways to make it better. Simple as that. That reminds me also of our patient helpline. I can't talk about Patients Rising without talking about our patient helpline. So, whoops.
And I was going to ask Jim, just to let our friends know out there, these classes that we're referring to are all virtual. That's
right. Yeah. You don't have to be in a specific place. You can take these classes at 2:00 in the morning under your blankets if you want to. That's where I take them.
And also, I appreciate that you understand that we have chronic illnesses, and sometimes if we can't submit it on time, you're like, it's okay. We know that you can't. You have a bad week or something. I really appreciate that, because that happened to me when I was taking the class. So.
Well, thank you for mentioning that, Danielle, because I think it's important. Yeah, I would want everyone here to know that even though we have to build some structure around having a master class or a Be Your Own Best Advocate class, we are you. You are us. We get it. If you need an extra month to do your assignments, you're going to get it. I mean, I haven't kicked anybody out of anything ever, and we're not going to start anytime soon. So we're going to make it work together, all right? Because we're all in this together. I'm going to try not to say together too much more, but just let it linger in there.
This is the community conference. So we do talk about community. This is all about building a community, knowing that people are not alone out there, even though it may feel like it, but we have a lot of friends that have been showcased on the conference, and we're building this community of resources so people can really lean into that, especially now, just having a light force or Care Bear Stare, whatever you refer to, Justice League, all of us teaming up and working together to create change. And that's what makes it so wonderful. So with these online classes, you can learn at your own pace. So those of you that are perfectionists out there, like myself, who really get intense with deadlines, you can kind of calm your nervous system a little bit. There is some leniency there. There's some, and it's fun assignments that actually teach us to be better in storytelling and share. And there's different ways that you appeal to different learners through the course as well, through audio. If people want to do a little audio podcast, share their story written, because we all have our own strengths. So that's why I appreciate the diversity of the class.
Yeah, thank you for mentioning that. I think that the community aspect is really important. It wouldn't be a community if we didn't build tools and platforms that anybody could use. Right? We don't want to exclude anyone deliberately or even accidentally. So when we're putting these classes together, you don't have to worry about hitting too much legal terminology or medical terminology. Having come from a background of clinical research, we've learned, or we were taught, that when you're putting materials together, you're not talking down to people. You're just talking at a common level that everybody can understand. So we don't dumb it down, but we don't brag about, we're not showing off our vocabulary either. These are all classes that anybody can succeed in. And I want to say something else about asking for help, which is a big part of being a part of a community. It's not easy to ask for help. Depending on where you're from, there's a lot of cultural resistance to asking for help. In the US, I know that there's this like rugged individualism, and, like my dad, he could cut his hand off. He wouldn't go to the doctor. He'd just duct tape it back on, which is, don't do that, by the way. Asking for help is not a sign of weakness. As a matter of fact, because it's hard, it's a little bit like a sign of strength. If you can go to someone and ask them to help you understand something that's confusing to you, or even if you just need a ride to the doctor and you want to talk to your neighbor and ask for a lift, try to get over the fear and hesitance to do that. Because when we ask each other for help, we're not just potentially getting the help we need. We're giving another person the opportunity to do a good deed that makes them feel better about themselves. We strengthen all of us when we reach out to each other. So don't be afraid of that. And my Scouts Honor commitment to you is that you can reach out to me about anything. Nobody's ever going to get shamed. No question is too big or too small. So it's a safe place. We're in this big virtual safe place, and it feels really good. Really good.
Well, that's a perfect segue to the patient helpline and reaching out and asking for help and getting some services.
Oh, yeah. So the patient helpline I'd say that's kind of where my heart lives the most. Patient helpline was started back in 2019. And the original plan was that we wanted to field questions from people about things like what is step therapy? Why am I going through this? Or I don't understand what co-insurance is with my insurance. We wanted to talk policy and stuff. And so we were ready and prepared to do that. And then 2020 happened and everything changed, as you all know. So the helpline is a toll-free number and an email address and an online portal that allows people from all across the country to contact us about anything at all. And the reason we keep it really wide is because we believe access to healthcare is impacted by just about everything you can think of. All right. So if you can't afford food, you can't afford your meds either. If your car is in the shop for a month, maybe you're not going to be able to get to your treatment appointment or something. It's all interconnected. Shout out to Dirk Gently and the interconnectedness of all things. We can look up that reference later. Douglas Adams. So I'll get back on track. The patient helpline suddenly became a resource for people who are having housing and food instability, who they couldn't pay their utilities anymore. And so the helpline really changed, it flipped completely and became what the people needed it to be, which was some dedicated investigators. I'm giving a shout out to Samantha Sauer and Levi Peterson, who are our helpline investigators, navigators. These are the best detectives in the world. If there's a program out there that can help fix a certain problem, they'll find it. And we'll be able to share the information about how to use these resources with the clients who contact us. And we say clients because it could be patients, it could be caregivers, it could be family members, it could be social work. We've taken calls from United Healthcare because they can't figure out how to get somebody access to something. We figure it out. We give it for free because we believe that filling these little gaps that exist all over our healthcare landscape is vital. If you can't get to where you need to go, if you can't afford this, if you need a ramp because you've just become physically disabled and you don't know how to get one installed in your home, you call us, we find out, and we give you the information. We don't do it for you, but we do the investigating for you, and we share the resources and show you how to use them. So that's what the helpline does. And that's why I think the helpline is so special, because people have come to us with anything you can imagine. And sometimes people are in a really low state. They've had a really hard time. They're stuck. We get calls from people who are unhoused, living in their car with a chronic illness, trying to figure out how they're going to move forward, or from parents whose kids have serious mental health challenges and they don't know how to help them. What do I do? My kid is, bipolar and I don't know what to do. So we give advice, not medical advice, but patient advice. But more importantly, we connect people with the experts who know how to answer these questions. So if somebody calls us and has, say, a serious mental health issue, we're going to tell them about calling 988. We're going to connect them with nonprofits that support patients with mental health issues. We may even connect them with more social services type programs, like the Department of Social Services in their state, or maybe Catholic Charities or Feed the Nation. We have a really strong network of all these other partners who specialize in different disease states or policy issues or social issues. So we can get you to the next step in your journey. Just give us a call at 800-685-2654. I'm sure that'll pop up on a screen somewhere. Or you can email us, and this one's easy. You can email us at help@patientsrising.org. That's help@patientsrising.org. And your email or phone call is going to go right to our navigators, and they'll talk with you. This is a very personalized program. We'll have a conversation on the email or by phone. And oftentimes when people come to us with one issue, we end up identifying a few other things that we can help them with to move them forward in their journey towards successful, dignified healthcare. So yeah, that service is there waiting for you. So reach out anytime. We're always there.
Yeah, that's an amazing service. I feel like people don't realize the interconnectedness of things, like you're saying. And so, like you're saying, being able to call, and even if you're calling about one thing, that's incredible that you're able to, I guess, help people figure out other things too. Because, you know, if you're calling and you don't realize that you can help find other things for other people, like you're saying about cars, like I know, I mean, I don't drive. So if I were to have a problem and not be able to, you know, get to my appointment, I know I can call you guys and be like, listen, I don't have any way to access to get to. But I wouldn't think that that's something to call someone to get help about, you know?
Yeah,
that's like a health related issue.
Right. Most people don't think that that's connected to their healthcare. You know, You don't think of your car as part of your healthcare plan, but it kind of is. Oh, we talked a little bit earlier about cats making an appearance. Every time Jinx hears me talk, she shows up by the computer.
Jinx.
So, hi, Jinxie.
We need to add Jinx to the Pause for Fibro team. We have a lot of our Pause for Fibro team hard at work. Yeah, but Jinx we'd have to negotiate a better writer for treats for better appearances. Because I know King Cody over there with Crystal has asked for quite a bit on his writer.
Oh, okay. Well, she doesn't like green M&Ms. I know that. So we got to remove the green M&Ms. But another part of the helpline that's really important is that when people contact us, we're oftentimes learning about issues for the first time. So Sam, Levi, myself, we've learned so much just from talking with people. And as a result, we take those things that we've learned and we turn them into learning opportunities for others. So we have what we call information modules, where, for instance, we have an information module on how to find transportation for healthcare if you need it. We have an information module on how to handle things like prior authorizations and letters of medical necessity. We have an information module on biologics and biosimilars, because things that come to us that have lots of questions, we decide there are a lot of people out there with these questions who aren't calling us. So let's build the answers for them right up front so that they can access those. And again, those are all things you can find directly on our website. You go to the main page, patientsrising.org, and it's pretty easy to find your way around there. So you'll find the resources that you're looking for. And if you can't find them, you can ask for them and we'll get them for you.
I think it's important to learn about these resources, even from a standpoint of being a executive director at a nonprofit organization, because we get these questions in, but on our side, you know, we're affiliated more on the education piece, as opposed to knowing all the support services out there. We're not as well connected. And I know we have some friends also running organizations too that are watching this and being really resourceful. I tend, Crystal's in the audience, and I will always send her email and be like, do you know? But we get a lot of questions in this space. So it's so nice to know that there is an organization out there growing, and we need to help you expand this, because I'm sure that there's a lot of phone calls, and after this, even more phone calls going to be coming in. But for other organizations who are other people out there that are running these nonprofit organizations in specific health diseases space, how can we support this and the work that you're doing for the patient helpline?
That's a good question. And we always need help to be able to help others more efficiently. So one of the number one ways another nonprofit out there can tap into the helpline, the learning center, and help strengthen it while also taking advantage of it is to become strategic partners with us. So for example, we're strategic partners with the American Migraine Foundation. So if a migraine patient contacts us, we're going to help them the way we would help anybody who contacts us. But we're also going to let them know about American Migraine Foundation, because there are people there who are living through a lot of the same experiences that the migraine client is living through. So by having them as strategic partners with us, we know that we can tap into their expertise to help a patient get further in their journey. And in return, when somebody contacts them and has a question that they don't know how to answer, they can send them to us. So between the two organizations, we're able to sort of field different types of issues. Now, if you multiply that by all of the partners that we have, that means when somebody has a hospital bill that they're not sure how to handle, we may send them to our partners at $4 or Good Bill. If somebody is trying to get onto Social Security disability for the first time, we might send them over to Evans Disability, a law firm that we partner with that can help people navigate that process for the first time. If somebody calls us with fibromyalgia, guess what? We're sending them to Support Fibro, all right? Because you guys have lots of answers. You've been through the gauntlet, right? So you've learned a lot by doing that. If somebody's newly diagnosed, they have more questions than answers. So why not attach them, or connect them rather, with somebody who knows some of those answers? So if you want to support the helpline, short of giving us $1 million, and if there are any millionaires in the audience, we will put your money to good use. But short of that, making these partnerships between organizations and other nonprofits really helps us get resources to people faster and with total authenticity. You all out there have the street cred we're looking for, right? If somebody has fibromyalgia, Support Fibro, it just makes all the sense in the world that they should know about you and interact with you, become part of your community. And by doing that, they're still going to have access to the helpline. They're going to have access to the learning center, but they're going to have access to all the things that you all do, which are amazing resources. And heart, that matters so much, because it's so easy to get disillusioned. But there's heart in this network, in this collaboration, in this circle of friends and family that are all out for the same thing: a better quality of life for people with chronic illness, any chronic illness. So this is a little touchy-feely. This is like the lovey-dovey part. We got to love each other. We got to show compassion to each other, patience and understanding. And if we can do that, we can expect it in return from others. And the next thing you know, the world's a little bit better place than it was before we got here.
I appreciate all that you do. And you just have such a warm, welcoming personality, and learning about your history and why you became an advocate. It makes sense, and everything that you do at Patient Rising is perfect for what you do. And I just wanted to ask, as a writer yourself, if you could tell everyone about the Patient Rising stories, because I feel like that's such a powerful thing for patients to be able to do, to tell their own stories. So if you could tell everyone a little bit about that real quick.
Sure. So the Patients Rising Stories platform was specifically built to be an advocacy tool. By advocacy tool, I mean, when people get to tell their stories there, they're linking themselves to a particular congressional district. They're also highlighting some of the different policy issues that they've had challenges with or encounters with. That gives us the tool. Oh, and another cool feature is that once you tell your story, you get a little pin on the map of the US, so you can see other people who are in your area. You won't be able to find them. They're only identified by first name. But a lot of times people put their social links, so you might be able to connect with people that way. But it shows the map, the movement of certain issues. You can go and search by your specific diagnosis, or you could search by step therapy, or you could search by gaslighting. You can search by all number of terms and find the other people in the country who are maybe sharing experiences that are kind of like yours. But it doesn't just stop there. So we can use the Patients Rising Stories platform to create reports. We created a report to the state of Alabama, for instance, because we found that a lot of people reported transportation issues in that state. They didn't have the right support to be able to get back and forth to specialists and so forth. It wasn't a major problem, but it was enough that we thought, hey, maybe Alabama needs to know about this. So we put together a report. We sent it to some congressional representatives in Alabama. I don't know what happened to it because I'm not so much on the legislative advocacy side, but it's an example of how we can take your stories and actually turn them into action by treating them collectively and giving us opportunities to find both where and what the problems are and connecting them together so that they have, it's like a collective bargaining agreement. If you have more patients talking about a specific issue in a specific place, you suddenly get more volume, more weight to your voice and to your needs. Now, that alone would be really cool. But we also take those stories and we translate them onto our social media platforms. And why do we do that? Because we feel that when patients share their stories, it's not only good for the individual. It's not just cathartic to share what you've been through a little bit. And we're not just interested in what you've been through. We're also interested in like how many pets you have. Do you like to paint? Who your favorite band is? We want you. We don't want your diagnosis. We want you. Okay. And so we share that on social media because it's good for you, but it's good for other people to see, hey, I have the same diagnosis as this person, but I feel kind of like trapped in my home. But hey, this person is like painting and going on trips and things like that. It's an inspiration. Now, inspiration is a touchy word in the disability community, but I mean this in the best possible way. This is an inspiration porn. It's getting inspiration from others to maybe add things to your life that will improve its quality. So inspiration between disabled communities. We're all going through so much of the same stuff. Let's talk about those sameness issues, the things we have in common. And sharing stories can really do that. So between our Patients Rising Stories platform, that's patientsrisingstories.org, by the way, you can go there, you can tell your story, tell us where you're from, you can add photos. Ooh, you guys are fast. You can tell us about where you're from, what you've been through, but also what makes life worth living for you. The things that invoke your passions. Because if I have one guiding philosophy, and this goes beyond Patients Rising, it goes beyond everything. If I have one guiding philosophy, it's that we are all people first. The patient part is a hat we wear that we can sometimes take off and just be the person that we were meant to be. It might be painful. It might be uncomfortable. We might have disabilities while we're doing it. But it's important to remember we're far more than just a diagnosis or some entry in an electronic medical record. And we want to support people holistically to help them find their passion, support it, but also in that process, find support and resources to navigate the complexities of healthcare. Boy, I've been talking a lot.
Well, we love it. I mean, this is where we said to everybody too, this is sort of part one, because we know we want to connect back in 2024, but you have an opportunity to connect with Jim also on social media and Patients Rising. We're going to have to give all this information to you, condense it, probably write a blog on our website too, to also send people over. And Jim, for 2024, like what's ahead for you, for Patients Rising and the organization?
Oh, okay. Well, it's a lot of exciting things. First, I'll talk about my own plans for 2024. I plan on being in more places. I felt like for a while I've been so focused on the work that's happening at my desk. We're all remote employees, by the way, at Patients Rising. So I work from home. Don't worry, I'm fully clothed, folks. But I want to get out where the people are more. Opportunities like this to talk to to talk to my people. You're my people. Sorry, guys, you're my people. I don't know if you knew that, but now you know.
I love it.
Welcome to the nerd crew over here. So,
oh yeah. But yeah, I want to get to know people better. I want to have a better connection with families of rare disease kids, or people living with chronic illnesses or chronic pain issues, where you're not being heard. I want to help you be heard, and I want to hear you. So my intention is to do a little bit more traveling, get more involved in conferences, meetings, support groups, and things like that. That's kind of on behalf of Patients Rising, but Patients Rising gets Jim. You get Jim. Everybody gets Jim. Okay, I am who I am, wherever I'm doing service. So, but for Patients Rising, there's a very exciting program that's underway. We talked about earlier the issues of transportation. Well, sometimes giving people information about how to find non-emergency medical transportation in their local area, and how maybe they can get it covered by insurance and things like that, that's fine. But sometimes it just feels really weak. Like, oh man, we got to do better than this. So we're probably going to regret this, but we've decided to take the plunge, and we're creating our own dispatch service. At first, the dispatch service is going to service cancer patients and people with low vision or blindness across the country. Big program. And so we're trying to find other sponsors, both foundations and industry, to help us pay for it. The idea is that a patient comes to us and says, I've just been diagnosed with X cancer, and I need to go for chemotherapy treatments 12 times over the next 3 months. This is where I'm going. These are the dates I need to be there, the times I need to be there. We take that information, we do everything else. We book all their transportation for them. We pay for everything. All we do is give the patient back exactly what they need and nothing more, to just get in the car, get to where they need to go, get back in the car, and come home. Because transportation has been that big of a problem, certainly in the cancer community, where people really can't afford to miss a treatment because it might throw them off a very specific timing. So once we can prove the value of this program with cancer and low vision patients, we hope to expand it to everybody. That's a big ask, but you know what? You don't hit home runs unless you swing really hard. So that's what we're going to try to do. It may fall short of our vision, but if it helps a handful of people, have we not done some good? We can't let the big picture intimidate us from doing the good thing that's right in front of us. That's another lesson I would ask everybody to take away with them from this talk and from community sessions like this, and all together. Don't be intimidated by the grand scale of the problem in healthcare. Fix one thing at a time. It's all about baby steps. Every single thing that you can fix makes the world a little bit better, makes your quality of life a little bit better. So if you think you can't bite off the whole thing, don't bite off the whole thing. Just nibble at it until you can gradually, you look back and you say, wow, look at all that we've accomplished. And that's what every nonprofit is really trying to do, right? All my nonprofit people out there, baby steps, nibbles. And next thing you know, you look back, you've accomplished a lot.
Although I think I need to learn to nibble, because as you are saying all this stuff, I really probably should connect with Joe, because the nerd in me was getting overly excited on a potential technology feature of using GIS integrated with what you're doing for the dispatch systems. And I'm not going to distract everybody with that comment right now, and we'll continue on. But my nerd brain just went, and so I'll talk to you at another point, and we'll get into the GIS, ArcGIS system a little bit better.
Sounds good. I'd like the sound of that.
Danielle, do you have any last questions before we start to close out the interview?
I just appreciate everything you're sharing and everything Patient Rising's doing and everything that you do. And I can't wait to get everyone else connected, because I think it's so important. And I have learned so much from the advocacy course, or the masterclass, and I definitely want to take the what is the other course called? Sorry, brain fog.
Be your own best advocate.
Yes, definitely want to take that course. But like you were saying, taking nibbles, before I took the masterclass, I thought I knew, things to do for legislative. And then I took that course and I was like, there's so many other things I could do. And it's like small things, big things. So I recommend taking that course for everyone, because there's just like small things. It goes on a scale of whatever you feel comfortable doing to help in the legislative area.
All starts with feeling like you can safely enter into this space to do some learning. And we've built it so that it feels safe and comfortable and easy. And I run all of our educational programs, and you've probably picked up by now, I'm a pretty chill dude. So everything's going to be fine, folks. Everything's going to be fine. Just come to us and I'll walk you through everything. Okay.
Well, I think everybody is really enjoying your voice too. Even Crystal is like, you totally record poetry, inspirational. And I know I saw a comment earlier from Michelle. It reduces our nervous system. So calming. So this is what it's like to connect with Jim. Yes. And just as amazing storyteller working with you. Also, Frank says hello. Frank's on the Patient Senate, leading the Patient Senate with us. It's been amazing to work with Frank too.
Yeah. Gosh, we didn't even get to the Patient Senate. See, guys, this is why we need another session in 2024. There's a lot of stuff going on.
Or we'll have Patients Rising stream instead. I'll work with Joe on that too. Because there's a podcast, the Patients Rising podcast. Oh, yeah.
We're doing a lot. What is wrong with us?
You are doing a lot. There's a lot going on. Shout out to Terry as well. She's really working hard and doing a lot.
She is our fearless leader. And because she's not afraid to tackle anything, we get our hands into everything. And we're happy that we do.
Well, and I think organizing some of the other organizations too, as I said, we may be in specific populations, but on the grand scale of healthcare policy, patient support services, all of that. There's something here too in the future of maybe doing a meeting of the mind so we can collaborate and figure out what type of services and things that we're missing. Maybe like I know we're doing the Patient Senate as a replica. Maybe there's something there. I don't want to say like United something, but for just a general meeting, it'd be fantastic.
I would love that because once again, we're all kind of tackling similar issues, right? And so if every nonprofit out there is trying to reinvent the wheel every time a problem comes up, they're just going to be caught up in all that noise. Instead, let's tap into one another and the things that we've all accomplished, share our tools with each other, and the power of that, forget about it. Oh gosh. Yeah. Okay. We're going to definitely be doing something. Here I am committing myself to yet more work, but you know what? This is the mission. This is the life.
You have more help,
stop, Jim.
I know. And you have more help because it is needed. I know when everything shut down and some of the patients were reaching out to us early on because their caregivers couldn't come or their home care weren't able to come. So I was sending out, we remember it was called the toilet paper ferry. I was sending out toilet paper to all the support group leaders so we could distribute toilet paper, soap, laundry detergent, stuff that wasn't covered by certain things or what could be afforded through SNAP and those benefits. So we're streamlining it across the country, sending it to a point of person with all the goods being sent so they could distribute. It's challenging. And so we want to be able to collaborate with organizations like Patients Rising.
You guys are doing so much great stuff. That's why I feel so honored being here. We're all part of the solution. And working together like we do, it means everything. So keep up the great work. Support Fibro and the Fibro Network. You guys are incredible. And anytime we can be of service to you, just call. All you nonprofits out there, contact me. Let me speak in your support groups and stuff. I'm happy to do it.
Yeah, let's build that community and collaborate together. Yeah. We appreciate your time here, Jim, so much. And again, we'll be back in 2024. We have to do this again. We'll continue communicating. Where can everybody of our friends connect with you online?
Well, you can find me on LinkedIn as Jim Sliney Jr. You can find me on Instagram, either at the Patients Rising Instagram or at Uncle Jim's Place, my own little corner of the internet where I'm talking philosophy and wellness.
And playing music.
Oh, yes. Yeah. Some very good learning from music entries there. I'm on TikTok as Uncle Jim's Place too. Yeah, I'm not that hard to miss, or I'm hard to miss. So yeah, if you look, you'll find me.
Well, thank you again, Jim, for joining us at the Fibromyalgia Community Conference. This is 10 days straight of content that we're putting together for our fibromyalgia friends and other community friends all around the world. We thank you for tuning in here. Please do connect with Jim and the Patients Rising organization. As you see, they have a lot of services that you can connect with and find them online. So thank you, everybody. We will see you tomorrow.